Hi, I'm Denise Fleck with Sunny Dog Inc. Have you ever had a dog with an upset stomach or have them choke on their favorite chew toy? How about your fluffy kitty? Has she ever coughed up a fur ball or licked her paws obsessively until they became sore and red? Then there are those rattlesnake bites, the bee stings, even a dog that steals the burger off the barbecue grill. Life happens, and pet parents and anybody that works around animals needs to be prepared to help their loving pets when something does happen. Most of us aren't lucky enough to have a veterinarian velcroed to our hip 24/7. So when something does happen to our precious dog or cat, we need to know how to react quickly to rescue Rover or help Fluffy feel better. Pet First Aid is the way you can do this. It's by no means a replacement for competent veterinary care. Pet First Aid is the first thing in a line of medical treatment to get your dog or cat back on the road to recovery. In one scenario, you have a dog or a cat who has something not quite right with them. Maybe there's a puddle of vomit in the corner. Maybe you've noticed a swollen snout from a bee sting. Maybe Kitty just jumped on the stove after you removed the tea kettle and she now has burnt paws. But the animal is breathing and does have a pulse, although something is not quite right. So what we're going to do is perform Pet First Aid. In the second, more serious scenario, the animal has stopped breathing. This could be due to poisoning, electrocution, drowning, an assortment of ailments. The animal isn't breathing. We need to perform rescue breathing, or what I often refer to as mouth-to-snout resuscitation. And in the third, obviously most critical scenario, the animal isn't breathing and doesn't have a pulse. We need to perform CPR, a combination of the rescue breathing and chest compressions to keep that life-giving blood and oxygen flowing through all the tissues and organs of the body to keep that animal alive until we can get veterinary help. Please realize that whether it's an animal or a human, CPR is not a cure in itself. It's a means to keep the organs viable and the animal alive until you can get to that medical professional. By performing CPR, you haven't given the dog antidote for the poison he swallowed. You haven't cured a disease. You haven't performed a surgery to stop internal bleeding. But if you can keep that blood and oxygen flowing through the tissues of the body, you can keep the animal alive until you get to that veterinarian who can give the antidote, who can perform the surgery, or hopefully can cure the disease and save the life of your loving pet. I'm Denise Fleck with Sunny Dog Inc., helping you to help your pets.